You know, chances are most of us will have surgery at some point in our lives. But have you ever stopped to think about what really happens after you get wheeled into that operating room? Well, today we're going to pull back that curtain on anesthesia and break down the two main types you're most likely to come across. It's a huge question, isn't it? That moment where you just have to trust the medical team completely. It's built on a whole lot of trust, but let's face it, there's also a bit of mystery there. So let's solve some of that mystery, shall we?
All right, let's get right into it. To really get a handle on the difference between the two main types of anesthesia, we're going to follow the stories of two different people. They're both heading into surgery, but for very different reasons.
So, first up, we have patient A. He's a 50-year-old guy who's scheduled for an open appendicectomy. Then, we have patient B, a 45-year-old woman who's about to get a knee replacement. Now, their situations are totally different, which actually makes them perfect for showing us two fundamentally different ways to approach anesthesia.
Okay, let's start with patient A and his appendectomy. For his procedure, he's going to get what's called general anesthesia. And honestly, this is probably what most of us picture when we even hear the word anesthesia. The best way to think about it is like this. Imagine your body is a house. Well, general anesthesia is like going to the fuse box and flipping the main breaker. Boom, everything goes offline. These medications, they temporarily shut down your entire central nervous system. That means you're completely unconscious, you feel absolutely no pain, and you won't remember a single thing. It's a total but very carefully controlled system shutdown.
Okay, so based on what we just said, let's do a quick check. What is the single biggest defining feature of general anesthesia? Is it A, the patient is awake? B, they're still breathing on their own? C, they're completely unconscious and feel no pain? Or D, they can still respond to commands? Go on, take a second and think about it.
All right, let's knock these out one by one. Awake and aware? No, that's a definite no. That's pretty much the exact opposite of what we're aiming for. That's closer to what we'd call sedation, which is a much, much lighter state.
Okay, so what about breathing on your own or being able to respond to the doctors? Not quite. When you're under general, your body's automatic pilot is basically turned off, so breathing is almost always assisted by a machine. Breathing on your own, well, that's a huge clue for the other type of anesthesia we're about to get to.
So, that really only leaves one option, doesn't it? The most crucial point, the thing that makes general anesthesia what it is. It all comes down to this.
C, that's the one. The patient is completely unconscious and unable to feel pain. That's the whole ballgame. It's this carefully controlled deep sleep that makes bigger surgeries, like our patient's appendectomy, possible.
All right, now let's switch gears and check in with our second patient. Remember her, she's getting a knee replacement, and for that, she's getting regional anesthesia. And trust me, this is a whole different world.
So remember our house analogy? If general anesthesia was flipping the main breaker for the whole house, regional is like finding the circuit for just the kitchen and flipping that one switch. The medication is injected near a specific bundle of nerves, basically creating a roadblock. Pain signals from, say, your leg just can't get to the brain. The kitchen lights are out, but the rest of the house is running just fine.
So, for a surgery like a knee replacement, what's one of the biggest benefits of going with this regional approach? Is it A, you get complete muscle relaxation? B, it makes sure you're unconscious? C, the patient stays awake? Or D, you don't need any pain meds after the surgery? What do you think?
Okay, let's start with D. Does it mean you won't need pain meds later? If only. Regional anesthesia is amazing for pain relief during and right after surgery, but you're definitely going to need a pain management plan for the days that follow. So D is out.
What about being unconscious? Well, hold on, we just learned that's the whole point of general anesthesia, right? With regional, the goal is actually the complete opposite. So we can cross B off the list too.
That means the really big advantage, the game changer when you compare it to general anesthesia, especially for a procedure like this, is you got it, it's C. The patient can stay awake, or, maybe be lightly sedated, but they're conscious while the part of their body being operated on is totally numb. This is huge because it helps them avoid some of the risks and the overall stress on the body that comes with that full system shutdown of general anesthesia.
Okay, so we've followed our two patients, we've seen their different paths. Now let's do a little showdown. Let's put these two methods right next to each other to make the differences crystal clear.
This chart lays it out perfectly. Look at consciousness. With general, you're unconscious. With regional, you're awake. Pain sensation. General is the whole body. Regional is just one specific area.
And check out breathing control. General is machine-assisted, while with regional, you're breathing all on your own. See? Two totally different paths to get to the exact same goal, a safe and pain-free surgery.
So, what's the big takeaway here? Why did we just go through all this? For you, as a patient, why is knowing this stuff actually important?
Well, it's pretty simple actually. When you understand the basics, you can be an active participant in your own care. You can have a real conversation with your anesthesiologist. Look, both of these methods are incredibly safe and effective when they're chosen correctly. But different surgeries and different people call for different approaches. Knowing your options and being able to talk about them, that's the whole point. So always discuss the options with your doctor.
And that kind of leaves us with one final pretty cool thought. We've already moved from a simple choice of just asleep or awake to these super targeted techniques. So as we learn more and more about the human brain, you have to wonder, what's next? What could a truly personalized anesthesia look like? One that's tailored specifically to your own body, your own genes. It's a pretty exciting thing to think about. Thanks so much for diving into this with us today.